Welcome to Conversations and Coffee, where we have conversations that are authentic, lighthearted, and purposeful. Our conversations will be engaging. You will hear from industry experts that will have you saying, whoa, wow, I didn't know that. Join us, because it's all about you, your loved ones, and anyone who want to stay informed and, of course, living your best life. Now, as we continue to talk about prescribed medication, antibiotics was the second question that everybody wanted to know about. And when I was talking even with my son about this, and he had an antibiotic that he had to take. So when he took the antibiotic 3 days later, he was feeling wonderful. He was just like, I'm good, Mom. I don't need to take any more of this antibiotic. Can you tell us why it's important to take the entire regimen of an antibiotic, or does it even matter if you take it or not?
So here's why it's important, and here's why it matters. So an antibiotic is prescribed if you have an infection, generally from a bacteria. Mm-hmm. So bacteria are very good, and we've all heard of antibiotic resistance, mm-hmm. but bacteria are very good at developing ways to avoid, the antibiotics working on them. So when you take an antibiotic that is correct for the bacteria that is infecting you, you should kill it all. Otherwise, the bacteria that's left might get a little bit smarter than the bacteria that was there before. And then if it happens to make you sick again, that same antibiotic isn't going to work. That's the first reason. Mm-hmm. The second reason is, again, going back to the resistance side of bacteria and such, and just remembering that taking antibiotics indiscriminately is not the best choice either. We all know people that have that stash of antibiotics, and when they get a sore throat or they get a cold or they have a headache or they have a temperature, they know exactly what to take. Oh, I'm just going to take this. Mm-hmm. Well, that's not the best choice, because if it's not the right thing, all you're doing is training whatever bacteria are around mm-hmm. to avoid the medication that you're giving them.
Yeah.
And there's multiple bacteria that already exist today. Thankfully, most of them are still in a hospital setting or institutional setting mm-hmm. that are antibiotic resistant. Mm-hmm. And what that means is we don't have one that works.
Okay.
And when you don't have one that works, that means the bacteria wins when you get infected. Mm-hmm. Mm-hmm. And that's generally not a good outcome for the patient.
Definitely. Okay, eavesdroppers, you hear it. The antibiotic regimen is important. And my son, by the way, is named Michael too. So Michael, you need to take your entire regimen of antibiotics.
I'm currently having the same argument with our son. So it's
Okay, so with medication, now with seniors, I can tell you that in-home care, when we're, having consultations with families and things like that, and with those seniors who are wanting our services, sometimes when you get to talk to them about, they are telling you about their medications and things that they take and all those types of things, they then get a worry face. They know how much medication costs. It's very, very costly to them. And as an older adult, sometimes they choose whether they're going to buy this medication or not. And when they do this, it hurts them in the long run, because then it will possibly put them faster in a skilled care facility or an assisted living facility. But what I want to know from you, and to give to our seniors out there, give this information to them. Are there medications that are discounted at a pharmacy or free of charge? So they will then start to ask about these types of medications when they do, when they are prescribed to them, I guess.
So I know there's a few retail chains that Publix is the one that comes to mind here in Florida that have medications that they dispense that are free. I don't know off the top of my head what the list is. I do know that the list is public and they do put it out to providers. And hopefully, if I don't think they're the only ones that do it. And I'm sorry, it's just not my area of practice anymore to be up to date with the retail providers. I wish my wife was here because she would be 100% up to date with that. But that doesn't help us now, unfortunately.
But, well, I know it may not be your expertise right now, but what you're telling me is that there is a list.
Yes. And I do know that providers are aware of the list. And if they don't happen to have it, it's easy enough for them to get because, obviously a retail provider, a retail pharmacy wants that customer to be, in the store. So they make getting that information super easy. And I don't know if you can find it online. I do know that it's pretty readily available. And, if they're not free anymore, they're really inexpensive. Month supplies, $5, $3, less than $10.
Now let me ask this. This list, is it only available to the provider, or can the seniors or can anyone get their hands on this list of medication? So when they get ready to go to their doctor and the doctor is stating what they need, then they can say, hey, here's this list. Is this something on here?
As far as I know, yes.
Okay.
As far as I know, yes. It would take, you'd have to be proactive as the patient.
Yes.
And that's something maybe you guys as home care would look into, for sure.
That's why I asked, because we have those conversations with those seniors, with those families, and they need to know this information. Being very proactive with your care, whether you are in an ALF, whether you are a family member who are taking care of someone in an ALF, you need to know. And that is what we're doing here today, letting the audience know, because the more knowledge you have, like I tell anyone, knowledge is power. And Absolutely. The more you know, the more you can help yourself or your family member.
Absolutely.
Yeah, definitely. So with knowing about the medications that they take, and knowing about a list that they may have out there, another thing that seniors do, they take a lot of over-the-counter medications. They take these types of supplements. They choose them sometimes because they cannot even afford the prescribed medication. So they think that they can go back and use these supplements or something like that. What can you tell us about over-the-counter supplements when this senior is trying to make that decision, whether or not, hey, should I go and get this medication that's going to cost me $80, or I see an alternative right on the over-the-counter here for $10?
So generally, your over-the-counter supplements are not going to substitute for a prescription medication. There's probably a couple exceptions to that. Not going to name them, but the over-the-counter supplements that do a better job also have side effects, and they also have drug interactions with other things. So one of the the detriments of trying to do that, if you're on some medications and you're deciding that I'm going to take some supplements to try and save some money, you can end up with a drug interaction that a pharmacist who is filling your prescriptions isn't going to be aware of. Because as a pharmacist, if I'm filling your prescriptions, I don't know what you're buying at the store and taking. And generally no one else does either, and if you want to supplement vitamin D, go right ahead. If you want to have an extra Tylenol or something like that, because your joints hurt, that's probably not going to hurt anything. If you want to take some vitamin C when you don't feel good or every day or whatever, again, probably not going to bother anything. But some of these other, the sleep aids and the melatonins and I'm not saying melatonin doesn't work, but it can help with falls, especially with other medications, and you don't think about it when you're just saying, oh, that sleep medication is so expensive and this melatonin is $3. Well, that's okay. How much is the fall cost? Because, you don't know what to expect. You go into things thinking it's okay. Even Benadryl, Benadryl is a big one.
Yes.
I just take a little Benadryl to go to sleep. Yeah, that's okay. Do you get up at night to use the restroom? Well, sometimes. Ever fall or feel like, I'm tired. Okay, well, that's again, it's a fall risk. And you don't, between the drug interactions and the risks that people are putting themselves, they're just increasing probabilities that something else is going to happen. It's not really a risk. It's just probabilities that they're not aware of. And when you take some of these over-the-counter medications that are relatively common, you're increasing the probability of something else happening that is not really on your radar, that could end up having a worse outcome than maybe making sure that the pharmacist knows what you're taking for whatever reason.
Yeah. And speaking of just what you said, as you gave the example with the Benadryl and things like that, that's going to take me into the next question about defining double dosing or overdosing. What kind of effect can that have on a person? So say they are doing this and maybe combining the prescribed medication with the over-the-counter medication, and that's overdosing. So what are some of those effects that can happen? I think they need to know this.
Well, I agree with you. And again, what you're doing when you're combining medications is potentiating the effects. Unfortunately, it's not usually 1 + 1. It's usually, 2 × 2. So you're exponentially increasing probabilities of poorer outcomes happening because of the combination of medications. Every medication has a side effect, and the side effect might be that you get better because you took antibiotics and you feel better. The side effect might be that your joints don't hurt, but the side effect might also be that you end up with lower blood pressure. And then you take another medication that also lowers your blood pressure. So when you get up out of the chair, you just fell over because your blood pressure is low, and if you're not following it and you're not taking it every day and you're not aware that might happen, or the pharmacist that fills your prescriptions isn't aware that, this could happen because you didn't mention to me that you wanted to take, some Benadryl because it's seasonal allergy time. Benadryl's flying off the shelf. Everybody has a runny nose in Florida in the spring. Yeah. It happens. But those folks that are on 3 blood pressure medications, if somebody doesn't tell them, hey, be careful, then they may not be careful. And that's where I worry as a pharmacist of, what can we prevent? And how can we help somebody really, again, going back to that optimizing their therapy, making sure that they're just, I also truly believe that in 2022, no one needs to suffer either. If you have allergies, well, there's a way to help your allergies. If you're having sleep issues, there's a way to help your sleep issues. Let's look into what the best way is and optimize it to make sure that not only does it work the best, not only is it the minimum amount of medications, but you're also decreasing the probabilities of some kind of other outcome happening that's also undesirable.
So going deeper into this, that question and the answer that you gave us, I know you're not into retail pharmacy anymore, but if a person was at the counter, the pharmacy counter, and they don't want to overdose or, they don't want these things, counteract reactions to be happening, can they have a consultation
Absolutely.
with that pharmacist and say, hey, these are the medications I'm taking. I want to take this over-the-counter medication. How would this react?
So I want to circle back to something that you brought up earlier, which was the free or low-cost medications. Mm-hmm. So part of me is very sympathetic to wanting those things. Mm-hmm. Part of me says if that's not the pharmacy that you're going to use all the time, then whatever pharmacist that you are going to ask the question that you just mentioned, because what if you go to two pharmacies? You go to one pharmacy for the lesser cost medications, mm-hmm. and that's where you're going to buy your over-the-counter medication that you want to ask if there's an interaction with. But that pharmacist there does not have any idea that you also go to another pharmacy and get other medications. Mm-hmm. So you're limiting the picture that someone that you're asking for their professional opinion sees, because they can only help you with what they know. So to bring it all the way around, my advice is always make sure you get all your prescriptions in the same place. Therefore, when you ask the pharmacist a question, the pharmacist will look at all the information that is relevant to you, all the drugs that you're on, and be able to make an educated opinion to help you the best.
Mm-hmm. Good answer. Oh yeah, definitely. Didn't think about it like that, and I know. Just kind of thinking about what I do, I work with families and work with these seniors and having those conversations with them. And they do have 2 and 3 pharmacies that they go to, because maybe this one over here was given a deal. If you come to us, we'll give you something for free. Then another one gives you this and another one gives you that.
Or the one child that takes care of half of it lives by one pharmacy, and another, person that's helping lives by another. There's a billion reasons. But to ask the pharmacist the question that you just asked me, mm-hmm. you have to think about, am I giving them all the information that they need to answer the question? Uh-huh. And that's something that I think people don't think about. And you're really in a unique position in the home care setting, especially, to be able to help provide all the information. If you want to ask the pharmacist, sure, bring them all of the information.
Yes, definitely.
And any pharmacist would be helpful.
Mm-hmm. Yeah, I didn't think about it like that. I'm so glad you said that, and our listeners are able to hear that, because I just never would have thought that would really make a difference. But the way you explained it, it does. It makes a big difference in what type of information that you're going to receive, inaccurate information you're going to receive based on your medications. Definitely.
Even with Guardian Pharmacy, we service, we service ALFs, mm-hmm. and we service skilled facilities. We try and service whole communities. There's plenty of communities that have independent living and that have ALFs and that have skilled care all in the same community, which I think is fantastic.
Yeah.
My opinion, the best choice is to make sure that one pharmacy has your information and can go carry that through all 3 of those settings, because doing that is is the key to helping reduce any chances of errors and getting information to the right people.
You're right.
If someone does go, God forbid, they go from independent living and they have an event and they have to go into a hospital, who's got the whole drug list? Who's going to all 3 pharmacies to make sure that we have all the drugs? So that all the drugs are correct for that hospital pharmacist who only wants, the hospital only wants you to have your correct medications, but there's plenty of times where they're just guessing because there's no central location for all that information because unfortunately people, for whatever reason, get their prescriptions from multiple settings. In ALF setting, even if we don't, at Guardian, even if we don't service the resident, we know what drugs they're on. We have a profile for them. And if a drug, isn't delivered on time or can't be brought or the pharmacy is closed or somebody couldn't pick it up, we can help that person and they don't miss any medication. And that continuity of care, that continuity of pharmacy care, I think, especially as someone enters into one of these types of communities, is super important.
It very much so. And that's how, we got to know Guardian because of just what you said, being in a senior living community where you have independent living, you have, your assisted living, you have your memory care, and being able to say that the whole community is a part of this one pharmacy that now know everything about the medications that the residents need. And that is so important, especially when they have to move out to the doctor and you get that medication list and you send that on with them. And then at that hospital, knowing what pharmacy that they use, because they have that medication list, they're able to get that information back to Guardian, and Guardian is able to fill that and bring it back to the community. That's what I love about Guardian. In a senior living community, you're able to help the whole community. And that's the way myself, that as an educator, as a person who works with seniors and families, I want to be able to service the whole senior, not just one aspect of whatever's happening, the whole thing. And when you're able to do that, as Guardian is doing in these communities and skilled care facilities, that's an awesome thing, because it really brings that circle 360. It's just it's there.
Absolutely.
Yeah.
The less care gaps there are, especially in senior care, the better chances you have for a more positive outcome, for sure.
Yes. Okay, so I want to get a little bit into, and we're almost done, but I want to get a little bit into medication myths. And my question was, can you tell me, and maybe you may not know, but you just tell me if you do, what are some myths that the elderly, seniors, families, anybody misunderstand about prescribed medications?
I think the biggest myth is that when you take a pill, you get better. And it doesn't involve any other effort. And even as seniors, even in senior communities, you don't have to watch what you eat because you're taking a cholesterol pill, and you don't have to exercise because you're, taking a blood pressure pill. I think whether it's a myth or the thing that's forgotten the most is that no matter what we do and no matter what age, even if it's just, chair aerobics, it's good for us. And the more we keep moving and the more we keep, trying to help ourselves, my grandmother used to say it's loosely translated from my Greek grandmother, but you have to kick with at least one of your legs as well, to help things work better. So, it's kind of that idea, and I think that's often overlooked. in the senior setting. And I think that's something we have to remember.
I can see that being a myth. I take this and I'm fine. Everything's fine. And again, it comes back into that whole circle. You got to do more than just take the medication. You got to do, whatever type of therapy you need for this, whatever type of mental health you need for this. All of those things help with the overall picture of and the health of the person. Definitely.
Absolutely. And
then my last question for you before we get into some fun personal questions. Can you tell me a wow or a why factor about the job that you do as a consultant pharmacist?
So I'll probably go into the why factor. I really enjoy being able to make an impact. And I enjoy being able to see, a result of an impact. And the long-term care community gives me as a consultant pharmacist that opportunity to see the impact, to see a person who may have, been having some kind of a side effect from medication and it was noticed or it was discussed and we switched it around and talked about it, and a suggestion that I made ends up having a positive impact on that patient's life, because we all have a limited amount of time, and folks in these communities, I guess for me, I want to make sure that whatever time anyone has left is quality. And to me, that's what's important. And that's my why. I want to, way down deep inside, I just really want to be helpful. And I feel that there's such an opportunity to be helpful. And, having the education that we get, with medications and in pharmacy school and then career experiences has really helped me, be as helpful as I can be.
Yeah, I love that answer. That is the same reason that I, decided that this is something that I need people to know, because it is all about servanthood, helping people to live their best lives. And you cannot do that if you don't have the knowledge or someone to say, come on, know this information in order to make sure that you live a long life. We have seniors now that's living a long, long time, and they're not doing that because they're just sitting at home and feeling sorry for themselves and not having enough knowledge to know these things. Whether they're in an ALF or a skilled facility or wherever they are, you can still make the best of your life.
Just to piggyback onto that statement about seniors living longer. So working in nursing homes and reviewing the charts of everyone in the nursing home for years and years and years and years, you see a lot of folks that are 98, 100, 102, 104, and they're definitely not as rare as they used to be. One thing I will tell you that they all have in common is they're on very few medications. Very few.
I can truly say that because I met this lady. She was 100. She was 100. I was at an event, and we were doing some marketing, and she came up and she said, "You know how old I am?" I was like, "No, ma'am, you're probably about 50. She's like, "No, I'm 100. I said, "Oh my gosh, 100? You don't even look 100 years old." And then she made it a point to say, "And I don't take any medication." And I was like, wow.
There was a lady we used to service their facility years ago. She was 102. She was born in a stagecoach.
Wow.
And she could tell you about stagecoaches.
Yes.
And that's pretty interesting. You know,
Yeah.
I don't think I'll ever meet anyone else who was born in a stagecoach.
Wow. Yes.
But, you know, and really I've been in facilities where the 100-year-old mother and the 78-year-old child were both in the facility.
Yeah. Yeah, it's really, really amazing just to see how our seniors are, you know, continuing to live their best lives. And that's what we want for them. I want that for myself. The older I get myself, I want to be able to say those things, you know, and people to say, wow, when I get to that age as well. So this is great information just for our listeners to know, for us as industry professionals, when they listen to this podcast as well, to know that we are here to help them with the knowledge in order to help our seniors out there. Definitely.
Absolutely.
So let's get into some personal questions. Right. I have some fun personal questions. The first question is, if you could have coffee and conversation with any famous or historical person, it could be in your field or not, who would you choose and why?
So, could it be someone from the past?
Yeah.
I would think, I would like to have coffee with George Washington.
Oh, wow. Okay.
I always like, you know, when you read about people's struggles and you read about, you know, somebody who really did something, you know, and was the pioneer of, you know, obviously everything where we're at today.
Yes.
You know, good, bad, or indifferent. I just think it's a pretty amazing person. And then even looking back and, you know, someone who walked away from that, what's the word? Power is really the word, but it's not really the right word, you know, and just said, oh, no, you know, I'm not here to do it all forever, you know, time for somebody else to do it. That to me that's a pretty amazing person that can do that. So that's somebody that I would love to talk to.
Oh, wow. Yes. I love that. I love that. Just, you know, like you said, from the beginning to where we are now, like what would that conversation be like? I definitely understand that. Yeah. So I also love to ask all our guests the same summation questions to have some fun. And your answers are more personal than they are professional. So try to think of the first word that pops into your mind, and that will be able to sum up our conversation today. And I call it 5-second thoughts. So the first one is, today you are
happy.
Super. Our conversation was
fantastic.
Coffee is
delicious.
It is. I love it. Now, this one, you can repeat it if you want, but it is, I love.
Oh, I love my family more than anything.
Wonderful. When I laugh.
Very loudly.
That is me too. Like, I'm always smiling. I'm always laughing. Wow. Yes. I am really
too serious sometimes.
But you said you do laugh out loud.
I do. That's when it comes out, it's out.
Yeah. My personality is
sarcastic.
All right. So thank you so much, Dr. Michael, for being a part of Conversations in Coffee.
Thank you. Yeah.
You're so welcome. It's always, you know, a great experience when we can learn more to help us, you know, seniors, families, industry professionals, to help us live our best lives.
Absolutely.
And so my hope is that our eavesdroppers today have learned a lot through your knowledge as well. So thank you so much.
Thank you for the opportunity, and I hope so as well, for sure.
Yes. I cannot wait until they hear this and spread the word, not just hear it and keep it to yourself, but be able to spread the word to everybody. Definitely.
Absolutely.
So one more thing for my eavesdroppers, and this is for you eavesdroppers. You know that I'm a conversationalist by heart and an educator by trade. So I want to keep the conversation going. Let's continue this conversation in the comment section below. And I will have some conversation starters to help you. The first one is, what was eye-opening about this conversation today with Dr. Michael? And what other questions you may have concerning medication do's and don'ts that maybe you want to ask Dr. Michael in the comments below. Keep eavesdropping, especially in the comments, and we will see you the next time on Conversations and Coffee with Dr. Joy.